Konnichiwa guys, let's study about platelets. Now there is one practical of platelets called platelet, counting your own platelets under the microscope. So it is important that you know the functions of platelets, what they do and what they not do, what is their composition, their structure and everything. Because that is what's asked in Viva, and that is what was asked in Viva from me as well. I did answer, but yeah, I'm only human after all. I'm only human after all. Don't put your blame on me. And now, steps of hemostasis. First of all, what is hemostasis? Hemostasis is the arrest of bleeding while maintaining blood in a fluid state within the vascular system. It is the arrest of bleeding at the injury site. Basically, that's it. Now there is something called primary hemostasis and then secondary hemostasis. Now primary hemostasis, it is the initial stage during which vascular wall and platelets interact to limit vascular wall platelets interacts in primary hemostasis. Okay, to limit the this is called temporary hemostasis. A platelet plug cannot allow. Secondary hemostasis, it forms a stable fibrin clot to form definitive hemostasis. Primary hemostasis is the temporary hemostasis, whereas the secondary hemostasis is the definitive hemostasis. Formation of clot in the vicinity of platelet plug finally stops bleeding. Now steps of homeostasis. Homeostasis occurs in 3 stages. Remember, 3 stages. Vasoconstriction, temporary homeostasis, plug formation, blood coagulation. Vasoconstriction, primary hemostatic plug formation and blood coagulation. Now vasoconstriction, immediate response of blood vessel to injury is vasoconstriction. This occurs due to contraction of the vascular smooth muscles in response to injury. It instantaneously decreases loss of blood and also helps in platelet plug formation. Contraction of the vascular smooth muscle to injury is initially a mechanical response. Stretch induced contraction. However, later vasoconstriction is maintained and potentiated by secretion of vasoconstrictor substances like serotonin from the activated platelets. We studied in the first video of this series that in serum, serotonin is, like I was saying, in serum, the clotting factors are not present, especially the fibrinogen. Therefore, serotonin level is a lot higher because of activation of platelets. Now, first comes vasoconstriction. Vasoconstriction, it is the immediate reaction of it is the immediate reaction of blood vessel to injury. this occurs due to contraction of the blood vessels and is initially a mechanical response, that is stretch-induced contraction. However, late vasoconstriction is maintained and potentiated by secretion of vasoconstrictor substances like serotonin. Serotonin is also a vasoconstrictor. So, serotonin is also a vasoconstrictor. So, it is released in vasoconstriction. Now, the second heading of hemostasis is temporary hemostatic blood formation. Now, formation of platelet blood at the site of injury is called temporary hemostatic blood. This occurs due to three properties of platelets. Okay, there are three properties of platelets: 2A and R: adhesion, aggregation, and release reaction. Adhesion, aggregation, and release reaction. Okay, the initial response is to adhere to the injured vascular site, and then there is aggregation to stick with other platelets, and then release reaction which further facilitates vasoconstriction, adhesion, aggregation. This forms temporary hemostatic blood and therefore called primary hemostasis. Now, blood coagulation. Primary hemostatic blood. Blood coagulation, immediately clotting mechanism initiates the formation of blood clot occurs in and around the platelet blood staple, and therefore basically after forming temporary hemostatic blood, we need something around this blood so that it can be further become definitive. Okay, so over here our blood coagulation is where fibrin tissue factor coagulation system activates, that with these factors are present in the blood which cause blood coagulation around these platelets. Okay, so the endothelial cell, collagen, then add vulgar von Willebrand factor. Von Willebrand factor, VWF. Adhesion, aggregation, secretion. Now our BD, that is platelet, primary platelet blood. Platelets, let's just say, consists of dense bodies, alpha granules, dense granules, and lysosomes. Okay, and it consists of various factors which help in adhesion and aggregation. Now for aggregation, there is factor called GP, 2B, 3A, and for adhesion there is GP, IB, 9. Okay, and VWF, which was further used for adhesion. Now, as we can see, GP, IB9, GP, 2A, 3B, 2B, 3A, 2B, 3A, IB9. Okay, Now thrombopoiesis. Yeah, this can be asked in viva. So same pluripotent stem cells, committed stem cells. Now basically stem cells then consist of myeloid progenitor cells. Myeloid progenitor from colony-forming megakaryoblast, promegakaryocyte, then granular megakaryocyte, mature granulocyte. Then let's just remember it again. Stem cell, myelohyoid cell, CPU mega, then megakaryoblast, then promegakaryocyte, then granular megakaryocyte, and then mature granulocyte, megagranulocyte, then platelets. This is the stage of thrombopoiesis. Now regulation of thrombopoiesis, thrombopoietin. It is produced by liver and works using feedback regulatory mechanism. Interleukin thrombopoietin stimulate the production. Now we should know structure and functions of platelets. Functions we are already aware of. Let's dive deeper into the structure. So they have specialized canalicular system, right, and a highly developed cytoskeletal system. Cytoskeletal system. They have numerous granules and phylopodia, like pseudopodia. They have phylopodia, open canalicular, deep tubular, dense bodies, glycogen molecules, granules, trilaminar cell membrane, submembrane, microtubule, exterior. So open canalicular system and deep tubular, dense bodies, glycogen molecules, granules, alpha granules, dense granules, lysosomes, glycogen molecules, right? So cellular content, let's say dense bodies, alpha granules, and lysosomes. Okay, so alpha granules contain growth factors, coagulation factors, and adhesion factor, like right here. Whereas dense granules secrete serotonin, ATP, calcium. Alpha granules are the main boss, whereas dense alpha bodies are dense because of ATP, serotonin. Alpha granules contain growth factors, adhesion factors, coagulation factors like factor 5 and 9. Okay, 5 and 9 fibrinogen. Let's remember fibrinogen for sure. Regulation factor 9 for sure, because there was something called GP1B9 1B9 and 2B3A, right? So yeah, dense granules. That's it. Then properties of platelets, which are adhesion, aggregation, release, secretion, pseudopodia, thrombin, platelet release, aggregation. Non-Wilbert factor present on the endothelium. There is GP1B9. Yeah. Okay. GP glycoprotein IB9 requires V1 Willebrand factor and GP 2V and 3L. These help in aggregation. Whereas IgP, IA2A. Now variation in platelet thrombocytopenia. Thrombocytosis is increased usually after surgery in chronic infections, splenectomy. Thrombocytopenia also occurs in dengue. Thrombocytopenia occurs in dengue as well, and massive transfusion of stored blood, aplastic anemia, HIV infection, and purpura. Thrombocytopenia, purpura, irradiation of bone marrow, cytotoxic chemotherapy, increases after surgery, iron deficiency, then blood loss. 1.5 to 4 lakh per millimeter cube. 70% are released from bone marrow, 30% spleen present, critical count. Thrombocytosis. A role of platelets in formation of primary hemostasis, adhesion, aggregation, and agglutination. Now bleeding time. When we talk about platelet function test, when we do this thing called calculating the bleeding time. Bleeding time is indicative when bleeding time is a surgery. It is prolonged in thrombocytopenia and thrombocytopenia, functional. Platelets determine the bleeding time. If the bleeding time increases, means there is some problem in the platelets function. Could be thrombocytopenia or thrombocytopenia, where the quantity is normal but the quality of the platelets is twisted. Let's say thrombocytopenia. If you say this word, your Viva teacher will be very impressed. I can bet. Idiopathic thrombocytopenic purpura. It is an primary autoimmune purpura. Let's start with blood coagulation. This, I guess, the only thing you need to remember are factor 1 is fibrinogen, then factor 4 is calcium, then factor 3 is tissue thromboplastin, and then factor 9 is Christmas factor, 10 is Stewart factor, and there is no factor 6. Then there is the 13th factor is fibrin stabilizing factor, 12th is Hageman factor, right? And then factor 7th is anti-hemophilic factor. Just remember till that. There's something about protein C is said to fibrinolysis should be also here. And this fibrinolysis. So there are two pathways: intrinsic pathway, extrinsic pathway. Intrinsic pathway, vascular injury, and intrinsic pathway is tissue damage. Okay, now exposed collagen, negative surface, and there is what is HMW, I always forget it. High molecular weight, yes. High molecular weight, kininogen and Kelly green. First 12th factor, Agaman 12th A, HMW, the 9th A, no, 11th A, 9th 9A, 10th A. Here 8th factor is phospholipid calcium, and then phospholipid calcium, prothrombin to thrombin, and fibrinogen to fibrin, and stabilizing fibrin polymer. Clot is formed. Treating factor is used in common. Okay, stage 1, stage 2, stage 3. So there is vascular damage and the release of tissue factor, that is the third factor, right? And number 7 to 7, 10 to 10A. That's it, the same shit as procedure. Here is 3, 7. Here it is 12, 11, 9, 10. Yeah, that's it. Then there is this fibrinolysis, thrombomodulin. Thrombin is basically does both coagulation and anticoagulation. Coagulation goes against coagulation. So vascular, here it is, we need to remember thrombomodulin, protein C, protein S, and that's it. So vascular endothelium produces thrombomodulin, and with the help of thrombin they activate the protein C, and then protein C with the help of protein S. The protein C basically inactivates the 5th and 8th factor and 5th factor. This is the 8th factor. Now 8th factor inhibits the intrinsic mechanism of clotting. So activation of plasminogen activators, and plasminogen is converted into plasmin, and then fibrinolysis, FDP, fibrin degradation product, protein C and protein S. PlAt-E-LeT is used in Winthrop tube. Sodium citrate, coagulation by inactivity, calcium ions. Yes, this is also a Viva question I was asked. Prothrombin, it inactivates the calcium ions. Sodium citrate. Yeah, EDT say always remember chelating effect on blood calcium. And sodium citrate also does something similar. Something I don't remember what the teacher told me back then. Yeah, sodium citrate EDT forms chelating factor with calcium, which prevents the activation of intrinsic. can be done by Duke method and IV method. Duke method, it is 1 to 5 minutes. IV method, it is 5 to 11 minutes. Yes. Then, yeah, should remember that. Hemophilia A is due to factor 8. Okay. Sick hemophilia. Christmas factor is due to factor 9th, 8th, 9th, hemophilia A, hemophilia B, then von Willebrand disease, addition, phase reform report effect and permanent.